Colorectal cancer is a serious health concern, often developing without noticeable symptoms in its early stages. It's the third most common cancer in both men and women, making it a silent threat that requires our attention. The good news is that colon cancer is often preventable with regular screenings, early detection, and positive lifestyle changes. Our colon plays a vital role in our overall health, responsible for removing waste products from our body. Maintaining a healthy colon is crucial for optimal digestion, nutrient absorption, and immune function. When our colon is compromised, it can impact our overall well-being. One of the most effective ways to protect ourselves from colon cancer is through regular screening. Colonoscopy, a procedure that allows doctors to examine the lining of the colon, is considered the gold standard for detecting colon cancer early. This simple procedure can detect precancerous polyps, small growths that can develop into cancer if left untreated. By detecting these polyps early, doctors can remove them before they have a chance to turn cancerous. This proactive approach is crucial in preventing colon cancer and improving survival rates. Remember, early detection is key when it comes to fighting this disease. Colonoscopy plays a crucial role in maintaining good colon health by allowing doctors to visualize the entire colon and rectum. This procedure enables the detection of any abnormalities, such as polyps, inflammation, or other irregularities that may indicate a problem. Polyps, small growths on the lining of the colon, are often benign but can sometimes develop into cancer over time. Colonoscopy allows for the removal of these polyps during the procedure, effectively preventing the development of cancer. This preventive aspect of colonoscopy makes it an invaluable tool in the fight against colorectal cancer. Early detection is key when it comes to colon cancer. When detected early, colon cancer is highly treatable with a 90% 5-year survival rate. However, if cancer spreads to other parts of the body, the survival rate drops significantly. Colonoscopy not only aids in the early detection of cancer, but also provides valuable information about the overall health of your colon. By identifying any inflammation or other abnormalities, doctors can recommend lifestyle changes or treatments to improve your colon health and prevent future problems. A colonoscopy, while sounding intimidating, is a relatively straightforward procedure. It is typically performed on an outpatient basis, meaning you can return home the same day. During the procedure, you will be given sedation to help you relax and minimize any discomfort. You will lie on your side while a thin, flexible tube called a colonoscope is gently inserted into your rectum. The colonoscope has a tiny camera attached to it, allowing the doctor to view the inside of your colon on a monitor. As the colonoscope is advanced through your colon, air is gently pumped into the colon to inflate it and provide better visibility. While this may cause a feeling of fullness or pressure, it is generally well tolerated. If any polyps or abnormalities are detected during the colonoscopy, the doctor can remove them using tiny instruments passed through the colonoscope. These polyps are then sent to a lab for analysis to determine if they are precancerous or cancerous. Proper preparation is key to a successful colonoscopy. Your doctor will provide you with specific instructions, but generally, you will need to cleanse your colon thoroughly to ensure a clear view during the procedure. This typically involves following a clear liquid diet for 1 to 3 days before the procedure and taking a laxative solution to empty your bowels. It's essential to avoid solid foods, dairy products, and drinks with red or purple dye during this time. Staying hydrated is crucial during the preparation phase. Drink plenty of clear liquids like water, broth, and clear juices to prevent dehydration. Avoid sugary drinks as they can interfere with the cleansing process. Following your doctor's instructions carefully and completing the colonoscopy prep as directed will help ensure a successful procedure and accurate results. Don't hesitate to ask your doctor any questions you may have about the preparation process. The colonoscopy diet, also known as a clear liquid diet, is an essential part of the preparation process. Its purpose is to empty your colon completely, allowing for a clear view during the procedure. While it might seem restrictive, it's manageable with a little planning. Stick to clear liquids like water, clear broth, fat-free, clear juices, apple, white grape, plain gelatin and ice pops, not red or purple. Avoid any liquids that are pulpy, red or purple, as these can interfere with the colonoscopy. While on the clear liquid diet, aim to consume small, frequent meals throughout the day to maintain your energy levels and prevent feeling overly hungry. Remember to stay hydrated by drinking plenty of clear fluids throughout the day. It's important to note that the colonoscopy diet is temporary and should only be followed for the specified period recommended by your doctor. Once the procedure is complete, you can gradually reintroduce solid foods into your diet. After your colonoscopy, your doctor will discuss the findings with you. If no polyps or abnormalities were found, you will likely not need another colonoscopy for 10 years. However, if polyps were removed, the follow-up schedule may vary depending on the size and type of polyps found. Polyps are categorized as either hyperplastic or adenomatous. Hyperplastic polyps are generally harmless and have a low risk of developing into cancer. Adenomatous polyps, on the other hand, have a higher risk of becoming cancerous if left untreated. The size and number of polyps removed also play a role in determining your follow-up schedule. Larger polyps or a higher number of polyps may warrant more frequent colonoscopies. Your doctor will discuss your individual results and recommend a personalized follow-up plan based on your specific findings. It's essential to follow your doctor's recommendations closely and schedule any necessary follow-up appointments. Following up after your colonoscopy is crucial, even if no polyps were found. Regular checkups ensure that any potential issues are caught early on, increasing the chances of successful treatment. Your doctor will recommend a follow-up schedule based on your individual risk factors and the findings of your colonoscopy. Adhering to your doctor's recommended follow-up schedule is essential for maintaining good colon health. If polyps were removed during your colonoscopy, your doctor will likely recommend a follow-up colonoscopy in 3 to 5 years to check for recurrence. Remember, colon cancer often develops without any noticeable symptoms in its early stages. Regular screenings are the most effective way to detect it early when it is most treatable. By staying proactive and following your doctor's recommendations for follow-up care, you are taking a significant step towards protecting your colon health and overall well-being. Don't delay in scheduling your follow-up appointments and prioritize your long-term health. While colonoscopy is considered the gold standard for colon cancer screening, there are other options available. These alternative screening methods can be particularly useful for individuals who are unable or unwilling to undergo a colonoscopy. One such option is a fecal immunochemical test, FIT, which detects blood in the stool, a possible sign of colon cancer. This simple at-home test is less invasive than a colonoscopy and can be done annually. Another alternative is a stool DNA test, which looks for DNA mutations in stool samples that may indicate the presence of cancer cells. This test is more sensitive than FIT and requires a stool sample to be sent to a lab for analysis. While these alternative screening methods can be helpful, it's important to note that they are not as comprehensive as a colonoscopy. If any of these tests detect abnormalities, a colonoscopy is typically recommended for further evaluation. Maintaining a healthy colon goes beyond regular screenings. Adopting a colon-healthy lifestyle can significantly reduce your risk of developing colon cancer and other digestive issues. Start by incorporating fiber-rich foods into your diet. Fruits, vegetables, whole grains, and legumes are excellent sources of fiber, which adds bulk to your stool and promotes regular bowel movements. Aim to consume at least 25-35 grams of fiber per day. Limit your intake of red and processed meats, which have been linked to an increased risk of colon cancer. Choose lean protein sources like fish, chicken, beans, and lentils instead. Regular physical activity is also crucial for maintaining a healthy colon. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Walking, jogging, swimming and cycling are all great options. Your colon health is integral to your overall well-being. By understanding the importance of colonoscopy, embracing preventive measures, and adopting a colon-healthy lifestyle, you can take charge of your health and reduce your risk of colon cancer. Remember, early detection is key when it comes to colon cancer. If you are experiencing any unusual symptoms or have concerns about your colon health, don't hesitate to reach out to your healthcare provider. Schedule your colonoscopy as recommended by your doctor, and don't delay in seeking medical advice if you have any concerns. By prioritizing your colon health, you are investing in your long-term health and well-being. For more information on colon health and colonoscopy, visit our website or consult with a healthcare professional. Your health is your most valuable asset, so take care of it.